Hello everybody to this ultrasound case of this week. And this case ultrasound illustrates how valuable ultrasound is to find something you don't know about it, but you are sure that it is abnormal. Now, many times in medical school you came across some pathologies that you cannot imagine how they exist, how they look like, what's the color of the tissues, and how they look in x-rays or some, let's say, modalities of imaging. But with ultrasound you can imagine it and you can feel it. Now, this is a 31-year-old lady who presented with lower abdominal pain since 2 days. She was afebrile, but on examination she was in severe pain. There was moderate to severe tenderness, mainly in the lower abdomen. Investigation revealed hemoglobin of 9.8 and normal leukocyte count. Now, at this time, the emergency doctor there cannot perform ultrasound exams, so he referred the case to the general surgery because he thinks it is acute appendicitis. So the patient waited a long time, and because the GS were busy with trauma patients, so they wait long time, 2, 3, 4 hours. At the end, they left against medical advice, not interested to wait anymore. Fortunately, they came back next day with worsening symptoms. Fortunately, the resident working there at that time, he was able to perform basic ultrasound, and he said, okay, let's do some ultrasound to see what's there. He joined some basic courses of ultrasound or point of care ultrasound, and he was performing ultrasound on a daily basis. So he was at least basic provider for point of care ultrasound. And this is transverse abdominal exam in the lower abdomen, and he found really something funny. He found large mass in the lower abdomen, around 10 cm in diameter. It is round, smooth edges, and consists of two echogenicity. Half is anechoic and half is hyperechoic. So what is it? Really, at that time he doesn't know what is it. This is another view showing some acoustic shadow as well. Here it shows the echogenic area with some acoustic shadow, so there might be some stones or some calcified structures here. Then he was unsure what is it, so somebody suggested to him that it could be an aneurysm, so he went back and applied color Doppler. There was no flow at all. So at this time he's sure that he found something abnormal. Definitely it is not appendicitis. So he was thinking to call his friends in OB/GYN. OB/GYN saw the patients and they suspected possibility this is ovarian cyst and complicated by torsion. So they did CT, and CT showed clearly large rounded structures with mixed echogenicity, and there are multiple septation as well, and there are some calcified structure as well. So definitely this is a rounded structure, most likely rising from the ovary, with multiple septations, multiple tissue densities, and there are some calcified structures as well in between. So the final diagnosis was high likely this is a dermoid cyst complicated by torsion. So the patient was taken to the OR for exploration, and they found large mass and they resected the ovary with the fallopian tube. And the pathology report shows cystic mass weighing more than 800 grams, filled with fluid, sebaceous material mixed with hair and some teeth-like structures. So at the end, the diagnosis was teratoma with torsion. In fact, I came across in the pathology book in the medical school, but I could not imagine how come teeth with hair and some skin tissues sometimes it happens inside the human body. But now I really saw it with ultrasound machine. So if I want to choose a friend in the ER, ultrasound would be my lovely friend in the ED, because it gives me a quick diagnosis, shorten the duration of stay of the patient in the ER, and properly dispose this patient to the proper service. For the plain films, are they still beneficial? Okay, don't be upset with the x-rays. This x-ray was done in 2012, when the patient presented with looks like benign abdominal pain and clearly showed there are some calcified structures in the pelvis, but it seems that nobody was concerned about this finding. Now, in retrospective view, this is definitely the calcified or teeth-like structures. If I had chance and I had ultrasound at that time, I definitely would see this ovarian mass, probably that she could avoid such result. So don't be upset, plain films, all is gold, but still ultrasound is my lovely friend. Thanks for watching.